Hi everyone, today we are going to be discussing emotional behavioral disorder or EBD. As a child progresses through life, there are many different obstacles that you face. I'm sure we've all faced different struggles and challenges, making friends, going to school, things like that. For someone who has a disability, they face the same challenges that we all face, but on top of that, they have the challenges that come with their disability. So in this presentation, we're going to talk a little bit about that. I'm going to introduce you to EBD. We're going to go through the definition of this disability, the cause of this disability, as well as an assessment for EBD, and I'm going to talk about one challenge and a few strategies, and then Bridget is going to talk about another challenge and a few strategies as well. So there are 13 categories under IDEA, and several of those categories of disability pertain to difficulty with behavior. So out of those several categories, one of these categories is EBD, and EBD affects a person's ability to be happy. It affects their ability to control their emotions and pay attention in school. And students with EBD often experience rejection in the classroom because he or she is unable to socialize with their peers due to the inability to develop interpersonal relationships. So this can maybe lead them to become disruptive in the classroom since they're maybe experiencing bullying, experiencing rejection, not having any friends or anyone to talk to. So that can play a big factor, and that is a characteristic of EBD. So the definition of EBD, IDEA defines it as a condition that exhibit characteristics such as inappropriate behavior, academic learning problems, an unsatisfactory interpersonal relationship. So as we talked about before, they experience rejection, maybe bullying, their academic learning problems, and a mood of unhappiness or depression. So that can maybe be caused by not having any friends, no one to talk to, not feeling like you're able to socialize with anyone, and that is a characteristic. So the last characteristic is a tendency to develop physical symptoms or fears that associate with personal or school problems. So again, that can be caused by bullying, rejection, unable to socialize. So, the causes of EBD can be caused by biological factors such as prenatal exposure to drugs or alcohol, an undernourished lifestyle, brain damage, or hereditary factors. It also may be caused by trouble at home or situations at school. So that is from the Juneau Youth Services in 2017. And there is many different assessments of EBD, but a study performed suggested that direct observations are more beneficial than clinical methods. And the advantages of not clinical methods, direct observations, the advantages are quantitative scores from rating scales, and that provides more reliable measures of functioning than subjective judgments. So, direct observations provide multiple items, and that can be incorporated to represent a diverse range of problems where maybe clinical methods do not. So it takes minimal time and training to administer direct observations, which makes the rating scales an efficient and economical method of assessment, and that is from the resources that are listed. So the first challenge for someone who may face who has EBD is they may show inappropriate types of behaviors or feelings under normal circumstances. So in the classroom, there may not be anything necessarily to trigger, or everything might be under control, you may feel, but even though it's a normal circumstance, they do show that inappropriate behavior or feelings. So this can negatively affect the impact their educational experience because they are causing the educator to postpone learning, to attempt to discipline them. So the students around them may chime in on this poor behavior, or things like that. The teacher has to stop the learning, so while the other students are sitting there, the student who is displaying poor behavior is being disciplined, and that can take a lot of time off of the academic display. So students with EBD commonly lack the impulse control and the emotional balance that is necessary to handle social interactions with other students effectively. So this may be a little bit of an explanation from Concordia University, Portland, as to why they are acting the way they are, or that shows that students with EBD, it's another characteristic, is the impulse control and emotional balance. So a strategy for helping behavior is that a recent study showed that the more positive attention that a teacher provides, such as contingent and behavior specific praise, the more that the students are engaged and the less problem behaviors occur. So to demonstrate the positive reinforcement is to give a child a compliment for a job well done, maybe reward them with a treat or something for answering a question right, displaying good behavior, things like that. And down at the bottom we have, by presenting a pleasant stimulus for after a behavior occurs, it increases the likelihood of the behavior to occur again in the future. Positive interactions between the students and the teacher can lead to an overall positive atmosphere. So by doing this and by showing the child if they do something good or something acceptable in the classroom, they may be rewarded, and that can encourage them to continue that behavior. So in 2004, a study was performed with 242 participants, and 78% were boys, 14% were girls, and they were just seeing how much the teacher could intervene before inappropriate behaviors occur. So it shows the token reinforcement system, contingency reinforcement, written feedback. So I think that, and it also says down there that research had shown that the treatments may not be maintained long enough to affect significant durable change for students with EBD. So I think that it's so important that we are being consistent and maybe putting the students in pod settings with the token system, where if they answer something right or do something good, they get a token, and they know whichever group has the most tokens is the one who will receive the reward. So that makes them want to strive to be on their best behavior and showing their best behavior in the classroom so that they do get those things. So the second strategy for behavior is a sensory room, which is a therapeutic space where students can go. I think it's really important that we are not giving this to them as a reward for say, or that this is just scheduled into their everyday daily schedule. So if they are showing bad behavior throughout the day, they know at this time they go to the sensory room and they release some of that stress. So the National Center for Education Statistics suggests that students with disabilities who spend 80% of the school day in a regular classroom went from 33% 25 years ago to more than 60% in 2015. So I think that by having these sensory rooms scheduled into the daily task of the student, that lets them know that at that time they will get to go relieve some of their stress. So instead of relieving it in class, they can relieve it in the sensory room. And I think that is very beneficial. So now these are just some of the different resources that I use throughout my portion of the presentation. And now Bridget is going to explain another challenge that a student with EBD might face and some strategies with that. Thank you.
So the second challenge that a child with EBD may undergo are social problems. So as we had talked about before in the first challenge, how behavioral problems greatly affect children, they also have serious social problems. So they just have a very hard time interacting with other people because they are naturally emotionally unstable. So with children with EBD, it's very important as a teacher to just remember that solving problems is going to be very difficult if you are just yelling at them and only telling them what they're doing wrong. Something that you should keep in mind is to reward children when you think that they deserve it, especially children with EBD, because those little words of um, affirmation like, oh, you're doing a great job, or I like how you were being nice to Billy today. You were sharing your toys, things like that, to kind of let them know that that's the behavior that you want from them. So to kind of let them know what is expected. But some things that children with EBD may do in the classroom are bullying others, showing signs of physical aggression, destroying things, or physically abusing others. So it's really important that you're watching them in the classroom so that they don't harm some of the other children in the classroom. So some strategies that can help with that challenge could be to have rules in the classroom to help the students know what they can and cannot do, to let them know that they can't get away with certain things just because they have this disorder. Another big thing that I think is important to keep in mind is that teachers should remain calm when they're punishing the child, because if they are just yelling at the child and just getting really mad, that's not helping them or the child. It's not helping their relationship, it's not helping with the situation. I think that it's really important that they understand to just kind of take a deep breath and just patiently and calmly explain to them what they did wrong and why it's wrong, to kind of give them the chance to know what is expected of them. And then another big thing that is helpful are routines, just so that the student can visually or like orally hear what is expected of them throughout the day, to kind of give them a heads up as to what's going on. I know something that can be very helpful in elementary schools is when they go through the calendar at the beginning of the day, where they kind of go through um, like the different subjects and when they are, or the specials that they have, to kind of give them the rundown as to what's going on throughout the day. And then another big thing that I would think would be helpful is to do a lot of group work, because with children with EBD, they have a really hard time interacting with their peers. So I think that a great idea would be to do lots of group work or like partner work. Because then it's giving them a chance to practice their relationship with their classmates. And I know a lot of schools have desks in little pods where they'll have like 8 desks together or 6 or just even like 4, just so that they can have some people around them to work with. So the last thing that I want to say about this is just that I know studies have shown that if a student has had a positive and strong relationship with their teacher, that then he or she will feel confident enough to socialize and create relationships with their peers. So it all kind of stems back to you as an educator, how you decide to handle situations, especially dealing with children with disabilities. So it's extremely important to just remember that you are their role model and they are ultimately going to look up to you, and they have such high respect for you. So if you abuse that power, then you're kind of in a tough spot. So in conclusion, students who have EBD do need additional support from their teachers as well as their peers. And something that honestly makes a big difference is just having patience. Because students with EBD will give you a hard time as a teacher, but you just have to remember that it's not the student trying to be a disruption to the class. It is the disorder that they have. So remaining calm and addressing the individual with compassion and concern is especially important. But anyways, so that is the end of our presentation. We hope that you were able to take some things away from it and maybe be a little more educated as to what the emotional behavioral disorder is all about. Thank you for your time, and we hope that you guys have a great summer.